What does it look like when doctors put electrodes in your brain? This is a skull presumed to have had deep brain stimulation, or DBS, so let's explore it. Deep brain stimulation is when electrodes are implanted into the brain to provide mild electrical impulses to certain areas of the brain. The brain has billions of neurons that communicate via electrical and chemical signals, and if there's less activity in an area, it may result in different medical conditions. DBS seeks to correct some of these medical conditions by providing electrical impulses to these areas, thereby increasing the activity of these neurons. Some of these conditions include Parkinson's, epilepsy, tremors, obsessive-compulsive disorder, among others. Let's talk about how these electrodes are actually put inside your brain. Doctors start by drilling burr holes into the skull on either side, and through this they're going to thread a wire lead that has electrodes. There's also going to be a circular groove carved around the burr hole, and this is so that a cap can sit over this hole, preventing the movement of the wire and also helping to prevent scalp erosion. As you can see here, we have the circular groove and the burr hole remnants. However, the hardware was removed and thus the patient healed and we have remodeling in the area. If we look at the internal aspect of the skull cap, we can see remodeling from the internal aspect of where the burr holes were. We'd also like to note that this individual was elderly when they passed, as we have suture closure and alveolar resorption, which just means they didn't have any teeth left. Brain stimulation stems from the landmark discovery of Alim Louis Benabid in 1987. He discovered that high-frequency impulses to the thalamus was able to relieve the tremor in Parkinson's disease patients without damaging brain tissue. DBS is considered a low-risk surgery. However, as with any surgery, there are always risks. Due to privacy laws, we don't have the complete medical records of this individual, so we can't definitively say that it was deep brain stimulation. Due to this bilateral placement of the burr holes, we do believe here at the museum that it is a deep brain stimulation case. However, there are other surgeries that put burr holes in the skull. Fun fact about DBS, the procedure is typically performed while the patient is awake, and this is so the doctor can test out where they've placed the nodes, and this will tell them if it's in the best area for the patient. Here at the Bone Museum, we want to make the knowledge of osteological history and procedures more accessible. Just got this specimen in at the museum, which is presumed to have had a DBS procedure done on it, so we want to make a video about it. If you enjoyed this video, make sure to like and follow the Bone Museum for more.